Hey everybody, Dr. Adam Harcourt here, and today we're going to talk about the third factor of migraine, which is the musculoskeletal side. Now this is one that can be kind of confusing because when you say musculoskeletal, that can mean all sorts of things, right? What I'm referring to is any type of stress on the muscular or bone system in our body, the skeletal system. And the reason for this is there's a ton of different treatments for things like trigger points or hypomobility, not moving too much, or tension in the spine, things like that. And so you'll hear or even see in the research that, acupuncture or chiropractic or massage or physical exercise or any number of things can help with migraine, and that's because it can, right? But the point is, all of those things are working on the musculoskeletal stressors of the body. So for example, if you got, a really tight shoulder up here and you go in for a really good massage and it loosens it up and you feel better and you can move better, well, that reduces the stress on that system. It's going to lower your chances of migraine, which is great. Same thing if you say your spine's not moving super well and you go in and see the chiropractor, you're moving a little better. Great, it reduces that musculoskeletal stress. Same thing with acupuncture. Acupuncture can do some great things for that pain system in the brain that is directly related to migraine. And so the point is, it's not just that you do all of those things, that you do the one that is important to you. So for example, in our office, we do a ton of different things just because of the fact that it's not just a tight muscle or a tight joint or a trigger point that could be causing the problem. So one of the things that we do is muscle work. So a lot of times we find in migraine patients that the upper back or the neck or the front of the neck can be really tight. And so there's a number of different techniques you can do to kind of work out those muscles, make sure that they're moving properly, get the inflammation out of there. Another thing that we do is low-level laser therapy. Now we're also using this for migraine treatment. We use it on the head. But for, say, neck pain or back pain, it's actually FDA cleared for neck and back pain. So it's one of the things that we find works really well because it gets in there and actually helps the cells regenerate. It stimulates what's called the mitochondria to produce more ATP, which is kind of like the fuel of your cells. And it heals those areas a little bit quicker so we can get faster results. Another thing that's interesting is there's research to show that what are called trigger points in both the SCM, which is that front, if you turn that big old muscle right there, or the trapezius muscles, which are those ones in the back of the neck, trigger points there, if you have them, your chances of migraine are increased, right? And a trigger point is just something where you push on it and it doesn't just hurt there, it hurts somewhere else, right? It radiates somewhere else. And so you can do things that actually get rid of the trigger points like ischemic compression or cross friction. And that's something that we will work on if you have those problems. There's other things like manual therapy, so traditional, more chiropractic type stuff where you can get movement of the joints, whether with hands or with machines. And then I also find that sometimes that's too much stimulation. So we have other techniques and other instruments basically that will get movement of the joint without any of the clicking or popping or the traditional stuff that you think about with manual therapy. So we have all those different options depending on what is needed for that patient. Then you have other things like vibratory therapy, we use what's called a rapid release technology that will get in there and it will really get in deep, up to 3 or 4 inches, where it helps to loosen up those muscles, break up scar tissue, get you moving a little bit better. So again, none of those things is the cure or the fix-all for migraine or even for musculoskeletal stress. But if you have a trigger point, you want to take care of it. If you have a stuck joint, you want to take care of it. If you have tissue that needs to heal, you want to get light in there to help it regenerate a little bit more quickly. And so that's the point of going after this holistically. Now, there's also situations where there's a muscle that's really compressing a nerve. Well, if that's actually going on, then there's surgical interventions or there's more invasive, you can use all sorts of different injections and medications and stuff like that, that sometimes are really a good thing for people. But again, that's a smaller percentage of the cases, and when you need it, it's awesome. But most people don't need it. So again, you want to evaluate those for those things. And if that's the next step, we want to get you the next step as soon as humanly possible. And we work with some really great doctors around the area that do those specific types of treatments and therapies. So again, there's no one magic bullet, but our goal is to provide as many different therapies as possible. So if you do have that musculoskeletal stress, we can knock it out, reduce it, and lower your chances and probability of having migraine.